Hello, I'm Toby Ingham and welcome to Counselling Buckinghamshire, my psychotherapy and counselling practice. I set up in 2000, I trained in the NHS, in addiction centres, in age concern, and built up experience of one-to-one work with adults. I've always been interested in people who might not know where to begin when it comes to dealing with a worry, a problem, or psychological distress. These days, there are all sorts of diagnoses spoken of. People will talk about OCD or anxiety disorder, bipolar disorder, depression disorder or panic disorder. So straight away, a problem is being treated as a disorder. Now I tend to think this is unhelpful language. I think it can be unhelpful to think of a problem as a disorder. A problem might be a problem, but that doesn't make it a disorder. Most likely, if you're given a diagnosis like this, you'll be sent for CBT. To my mind, not necessarily the best thing that can happen. CBT can be useful, but it tends to work by encouraging people to develop behaviours that get them past their problems without necessarily knowing very much about what the problem was about. I see unhappiness and anxiety not as disorders, but as relating to things like bereavement, betrayal or redundancy. Not as disorders, but as ordinary things that happen to us. I think suffering difficult emotions is just part of life. Difficult, certainly, sometimes almost unbearably difficult, but ordinary nonetheless. It is easy to get stuck in problems. Problems are like questions that we have to find a way to work out the answer to. If we find a way to work, so life starts to move again. In fact, oddly, finding a way to work on a problem can be very encouraging in itself. And that is what my psychotherapy practice is about. Finding ways to work on problems, to see how our problems are related to us, to find within ourselves the encouragement to persevere and see what we can make of our ordinary suffering. Please take a look at my website, www.counsellingbuckinghamshire.co.uk. I blog regularly on a range of psychotherapy and counselling subjects. If you have any questions, please email me and get in touch. Thank you.